Welcome everyone to FREDLA's Learning Community for Family Leaders. The topic of our call today is family-run organizations partnering with juvenile justice, and we have an excellent lineup of presenters today. This learning community is hosted by the Family-Run Executive Director Leadership Association, otherwise known as FREDLA. My name is Jane Walker, and I'm the Executive Director of FREDLA. We are a proud partner in the National Technical Assistance Center for Children's Behavioral Health, operated by and coordinated through the University of Maryland under a contract with the U.S. Department of Health and Human Services, Substance Abuse and Mental Health Services Administration. It's a mouthful. I know we have a lot of new people on the call today, and we really welcome you. For those not familiar with FREDLA or maybe new to these calls, FREDLA is a network of family-run organizations. There are about 120 organizations across the country that were started by families caring for a child or young adult with mental health or behavioral health needs. Our organizations have grown over the years, and a survey that was conducted, by FREDLA in 2017, just about a year ago. One of the things that we asked the 65 organizations that responded was, who do you serve? And 93% of the 65 organizations responding to the survey indicated that they serve youth involved in the juvenile justice system and their families. And yet, we also know that very, very few of our family-run organizations actually have formal contracts or grants with their juvenile justice agency in their state or community. Research tells us that the majority of youth in juvenile justice secure care meet the criteria for at least one mental health disorder, with as many as 7 in 10 youth in these settings living with mental illness. More than 3/4 of the youth in juvenile justice system are diagnosed with at least one mental health disorder and may be living with more than one mental health disorder. This chart, which I apologize, it's so blurry, but it really illustrates the issue that the prevalence of a mental health disorder among youth in juvenile justice settings is much higher than the general population. In this chart, on the top are youth 13 to 18 years of age in the general population. And the figures that you see in blue represent youth in the general population with a mental health disorder. The lower part of the chart, in the brown shaded figures, show youth in the juvenile justice population with mental health needs. This data comes from a publication called Mental Health and Juvenile Justice, a review of prevalence, promising practices, and areas for improvement. The publication was published by the National Technical Assistance Center for the Education of Neglected or Delinquent Youth, and was published in 2017. So if we know that large numbers of youth in juvenile justice have mental health needs, then we know that their families need support. The question then is how do family-run organizations work with juvenile justice to support families and by supporting them have better outcomes for the youth themselves. We have two excellent examples from Massachusetts and Arizona to share with you today, illustrating a strong partnership with the family-run organization and the local or state juvenile justice agency. We encourage you to, throughout the presentation today, we will pause for questions. So please write any questions you may have, or if you have resources to share. This is a learning community for all of us. So please put any questions that you may have in the chat box, and we'll be sure to take time, perhaps after each presentation, or certainly at the end, to answer any of your questions. If there are questions that we can't answer, we will get those answers to you afterwards. Also, the webinar is being recorded, and a link to the recording will be sent out about a week from today, and you'll also be able to download the slides from the webinar at that time. So we're going to begin with Massachusetts, and we're very pleased to have Lindsay Heffernan, the JDAI State Coordinator for the Department of Youth Services in Massachusetts, and Mary Viano, the Associate Director of PPAL, the Parent Professional Advocacy League and family-run organization in Massachusetts. So Mary, Lindsay, over to you.
Thank you so much for having us join this today. My name is Mary, the Associate Director for PAL, the Parent Professional Advocacy Organization, and we're going to talk about the Massachusetts model, both with the connection with the family organization as well as our juvenile justice state partner. So as we move forward, what we're going to have a kind of a conversation with, and we really appreciate the opportunity, but also would welcome any questions so that many of you could do some really out-of-box thinking of what your state's needs are. We're going to explain how our state system, DYS in Massachusetts, and the family organization have meaningfully connected. We're going to talk about the relationship and roles kind of from the beginning and talk about how we are after 5 years of collaboration. We're going to talk about the model of partnership that we've found very effective in our statewide level, and we'd also like to talk about just in our local level. We don't go by counties in Massachusetts, but the districts that we've kind of broken the state up into 5 different areas that we would be able to talk about how we've tried to get it at the local level as well that is really effective. We'll talk about the models of growth that's happening in Massachusetts and what the resources look like, specifically going back to what Jane had mentioned in this one commitment of a relationship, but also commitment with a contract. And then we're going to end with really talking about presenting change both in our community, with our families, with our stakeholders, and with our partners. And what we've noticed specifically, and Lindsay and I will try to talk about, is how important it is to both model and to build the trust between the family members and the stakeholders. And I bring the lived experience of having young adults now that have either needed support or have been connected in the juvenile justice. So I welcome questions.
Awesome. So this is Lindsay Heffernan, and I am lucky enough to be able to partner with Mary on a near daily basis. I work for our state's Department of Youth Services, and because I know everybody's a little different, I'll just explain what that looks like. DYS in Massachusetts is responsible for overnight arrest for young people, detention while pending a further court action, and commitment services. So we run in other jurisdictions. We are both sort of the county and the state all combined into one. And in particular, my work is around trying to figure out how to reduce the choke point at detention. Kids awaiting court. How do we make sure that they are not in detention for the wrong reasons, and that we get them into a better place. And PAL has been a huge partner in that. Just to give folks a sense, when we started JDAI 10 years ago, we had almost 4,000 kids in detention, and in the last calendar year, we were under 1,400. So it's a huge reduction but we still know we have a long way to go to make sure that all the young people who are in our care are getting the appropriate supports that they and their families really need. So when we look back, and Mary mentioned in 2007, really beginning this work, I think I at the time was a public defender and was actually a little bit outside of the system. Actually, along with Mary, we met as partners trying to figure out what is that big DYS all about, and I subsequently became employed there. But there was a lot of work to do to get a pretty large state agency with almost 2,000 employees between state employees and provider to really understand each other and understand the work that each was doing. I think that building trust has been an ongoing piece of work. Mary and I talk about it regularly, more work that we need to do in order to build relationships. But that did begin really at a high level. And with our commissioner and the leadership at PAL, early moves, I think, in getting PAL sort of into the room involved the DYS strategic plan, probably in 2011, Mary, maybe you can jump in there, and then figuring out how PAL could be supportive to the other stakeholders also within the juvenile court, so with probation and with law enforcement. PAL produces a great police pocket guide on working with young people with mental illness. They've done trainings with judges, and so they're a well-known entity in Massachusetts. And it was then really, as Mary said, we took a little bit of a leap, and we began in one region with a contract for the Department of Youth Services. As Mary mentioned, we're divided into 5 regions in the state in order for pretty small money to have PAL support families of young people in the system, and a lot of that was training and supporting families, and then we'll explain where we've gone to, which I think is a much more robust and statewide model of support.
Great. So as we continued in the beginning, what we really found is that the family organization was invited to many conversations, and it took I think partners within the state from every level really to understand what a family organization was and the lived experience that we bring and our experience to kind of give the opportunity, one, for teaching, modeling, and then also for change. In the state, we were able to model partnership even when it was hard, and I think that kind of concept of being able to trust family members that were in roles and employment to be able to bring back to say what is not working in the system directly from their community was definitely both a learning curve and also a partnership that was built. The involvement in the community conversations really took a lot of strategic thinking to be able to say kind of where did it make sense, who could we get at the table that we knew needed or was going to be an effective partner to make some change and involve families, and who did we feel needed a little bit more attention and giving it in different ways. One of the things that we really noticed as well is together we had family advocates doing training so that the shared experience and kind of a cross-training had happened. That was a big leap in kind of making that level. We're going to continue to come back to trust. PAL has been connected with the behavioral health and mental health system for a very long time, and I would say we saw this in the beginning, but there was a level of trust that took a deeper amount of time, dedication, and a lot of planfulness. From there, we really discussed kind of with families regarding what they would like to see as collaboration with the department and what challenges were coming up. JDAI stands for the Juvenile Detention Alternative Initiative, and one of the pieces that Lindsay had mentioned was that I was one of the first family members to be in that. Just like for many of you that are involved in system of care, you know the principles for wraparound, and in JDAI there's 8 core principles, very similar, but it's really kind of connected to the community, which we can send some information about if people would like to know that. But one of them really was to go into the facility and see what was working and not working for families, and that was really a big learning piece for both of us together. From there, kind of the family involvement and system partnership, we really got to a point where we were understanding all perspectives. We had to understand the system. They needed to understand why a family organization was there and kind of what that partnership would look like together. We had to really come to a point that we wanted to change the typical model that has been there regarding any young people within detention that were arrested or even that were brought into the courts. We knew that we wanted to make it a prevention model. We wanted to talk about diversion, but we really had to have some conversations on sometimes the first people that we needed to work with were the local law enforcement or working with probation in our state and having conversations. Culture of working with family organizations, we break down the alphabet soup. We don't talk in acronyms. We talk from experience. Sometimes our story can be a little bit longer. We try to also be very clear with what's working and not working. And there was also this model of what was helpful and what was harmful. And I think that teaching model was a big piece of the culture shift within both the system and for us being able to also understand the policies that the system had to then explain to families that if we wanted to challenge those, what that really meant. There's been a lot of training in the state, and I know Lindsay's going to touch on this at the end, but one of the big pieces that we've talked about within Massachusetts is dealing with our own biases that we might have or not have and maybe prejudice that are there. So again, going back to, do we think that all kids that have a felony charge should be locked up? How do we look at that, knowing the data that shows that the first time they enter, the level of percentage of youth that come back. But we also really had to work with people about kind of their own perceptions of the youth that were also being detained and why it would be important to give them the support back in their communities. In that, we also talked about, and one of the things that I think we can't stress enough is the racial and ethnic disparities, and we hired family members that really look like the communities of which they come from, and we're able to acknowledge that and have that connection. We also listen to parents and bring the family members and the parents, as well as the young people, their voices into another conversation with the system if that's ever needed. Showing respect and empathy for family members, this was an interesting one to really talk about what time the meetings were held, having people on the agenda. We've had I think the privilege, and I'm really noticing that it's a privilege and also a really big piece that has helped in that one of the things that we've seen is really having the empathy of understanding families' journey. That has been a big learning piece for us to explain to all members. And also the understanding of responding to family members and really kind of what they're looking for is important. In there, part of what we also did was we taught staff about families by the family organizations. So like Lindsay had mentioned, we're side by side a lot in modeling both the partnership that the system has as well as the family organization. I always feel included. The family organization as a whole feels included. If we are not in an agenda or in a situation, it's very easy to have a conversation. And I would say that really comes down to the trust in the relationship and some of the hard challenges that we have both been able to identify and work through. We're excited to say that within this partnership, we have identified training needs and have done some with the child welfare, schools, law enforcement, and we've talked about the racial equity and a training specifically that we've done in the community side by side.
Can I give an example, Mary, of that? I think just a few weeks ago, our state, like many states, has undergone a pretty significant status offense reform a few years back and developed what were called family resource centers, and these were placed in the counties and trying to really support families without having to bring your child to court for a status offense. And we see huge opportunities there to help juvenile justice families. And so when I was asked as a state agency person by another state agency person to go and talk about juvenile justice just a few weeks back, it wasn't just the juvenile justice staff that went. Mary came and another member of her team, so that we're there together talking about these both sort of the issues from a system lens, but then really what's going on for families and what's going on for young people. So I think that's sort of an example of our modeling this together all of the time.
And I think that we're really honest to say, Lindsay and I are kind of known to each other that if we can get on our calendar to meet with a really key player in the state, that we're texting each other or getting in touch with each other right away to say, here's another opportunity to model. So if it's not myself or Lindsay, it can be another person from the family organization and the state system, because we never want to lose that, that moment of being able to model that. So I think that's key. Thank you, Lindsay. One of the other pieces that we really talk about, too, is the value of our role, and that really establishing an understanding of what family involvement is and what family engagement is. And I understand and really appreciate that family engagement is a term that, for us, we're seeing really fly around the state in all state systems, but to really understand it and to do the work is something different. So we've actually broken it down specifically and have been training with the department on a regular basis, but also all communities on the difference between family involvement and family engagement, which is critical. So now just to kind of look at our formal program and kind of where we were. We're in our second year as partners in a contract with the state provider that has allowed for us to expand this support. And when I say expand the support, I just want to add that half of my time is paid for. We have a full-time project coordinator, and we have 5 family support specialists that work across the state, so 1 in each region. For families, this is really dedicated going back to prevention and detention kids. This is for the families whose kids are court involved on the front end. Diversion is our main goal. And I want to stress also that we can work with all families, including families that have multi-agency involvement or foster care children. So the department has been a huge believer in that. In our definition of what families are, we can be connected to everyone, and that has played a big piece in what we're doing and what our success is. And I would add that I think that it is also for many of the young people that are in the foster care system that are also involved in the juvenile justice system as well. So what do? We provide information and referral to families, so we're constantly teaching skills. We're giving families resources of what really is working in the community, what is available. We're being open and honest about waiting lists. We're trying to help prioritize a young person that maybe got to court, but it really was they weren't able to access mental health services or maybe some school support. So there's a lot of information and referral and kind of one-to-one support if needed to even explain to the parent what supports are out there. We continue to create, all of those family support specialists create local connections so that they are known within the courts, the probation, the police departments, other community organizations that possibly have different juvenile justice pieces that come up. We have 5 part-time, like I had mentioned, that are infused in the community, and that is a really big piece. I would say one of the things that we did do when we started, when we did the pilot programs, we did not have the full-time project coordinator that was focused on juvenile justice, and that has been a huge add to us to be able to collect data, collect the information that's needed, but I would say side by side, that is a bit of the infrastructure that the department has helped support the family organization in that has made a huge difference for us. So today, what we're looking at is December, from January to December of this past year, we were connected to 173 families. 130 of those families were referred directly from either the courts, probation, or the department themselves. The area that we had noticed, school suspensions, when we say duly involved, those are any young people that have more than one state agency involvement, so that could be our child welfare system or our behavioral health system on top of DYS. Some of the bigger issues also access to mental health, police interactions, so they've been called for the same kid several times, or there was an impulsive situation that had happened, and how are we going to support those families. School refusal also comes up, and that comes up more in our probation conditions, where there's been a condition that has been put on by probation, and the young person, for whatever reason, whether it be bullying, whether it be other mental health pieces that are coming up, or other behaviors, that we try to really figure out what is behind those needs. Family outreach, this is really interesting for us, and I'd be interested to hear what Arizona and other people have seen. PAL has been around, and I'm sorry I didn't say this in the beginning, it'll be our 27th year that we've been around as a family organization in Massachusetts. As we've seen the map change with families with needs that they have, I would say that this is definitely an area that we have reached out to families that have not connected to other, so parents that we're connecting to have never met another parent like them. I often say there's not the PTA group or PTO group for the kid that had shoplifted or the kid that had a certain amount of gang involvement. There's just not that level of connection. These families are upset that they've never met another parent, and many times it takes us really trying to prove to them that we, one, care and they can trust us. They get an outreach call within 24 to 48 hours from our family support specialists. We've noticed that we need to call at all times of day, whether it's the evenings and weekends, working with the families. We text them as well. If we do not hear from them after 7 attempts, and we do try 7 attempts, we will send them a card. We will actually do a handwritten card that doesn't look like a typical envelope that comes in. Many people, I think it's an invitation. But we really thought out of the box to try to get a parent to engage, which has helped. They are really taken back, and kind of the pieces that families directly have said to us is that they can't believe that the family support specialists listen as one that they're yelling or one that they're crying or cursing and saying different things, because they're just so frustrated on the way they've been treated. And that's prior to getting or needing support for their child directly. We really do a lot of out-of-box thinking, and I can't say that enough. We have multiple families, grandparents, fathers, mothers, aunts, uncles, whomever is connected to that main parental support that possibly works 2 jobs, that can only talk at AM because they're helping youth. And that has been a huge component of being able to connect to families. Some of the challenges that we've occurred, explaining the family organization has been a little bit tough. Explaining to them that, we are unique is one piece. The peer-to-peer role and that the parent-to-parent component is a huge piece that we're able to support has also been interesting, because they don't understand that, and they don't believe that we're not court-ordered has been another piece, and that it's mandatory. I would say that has been a huge piece also for parents to really buy in and want to have conversation with us, is that even though their child is involved, they've not been mandated to talk to us. The challenge has been definitely new relationships with the system when there's turnover with staff. Sometimes they need more information on who they can trust, who the collaborator is, and what that next step is. And we've noticed that has sometimes been a challenge where they step back a little bit. They may start disengaging from us, and we push forward to say, as the national data says, that the outcomes for children that have family involvement is actually better if they have a strong parental connection, and that has been a plus for us as well. So I'll hand it over to Lindsay.
Sure. So, and I think when you think about from the system perspective, as Mary was sharing, sort of from the family side, what are they getting out of it? From the system stakeholders, I think system stakeholders, be it judges or probation or DYS, see that we're getting support for what otherwise our folks would have called challenging families, and the ones who would call and scream at our clinicians and were upset and no one knew quite what to do with that, or the families that come into our court on assaultive cases against a parent or family member, and the parent isn't ready to take that child home, and we find, that we have the kids sort of melting down in our programs over some other issues that are going on in the house, and PAL is able to step in and have that conversation in a way that, frankly, no one in the state system can, and really talk level to level as a parent. Let's talk about what this is going to look like now that your kid is here, and where's that going to go next, and what's your relationship with your child going to be like. That frankly, just as a mandated reporter, there are limits in the ways in which we can engage. And I think as somebody who, from my role, that's sort of thinking about at the individual kid level, but at my level where we're trying to think about system improvement, we have parents now always at the table. Those family support specialists are in the room when we're talking about what needs to change in this county, what are the arrest patterns, what are the problems in probation, what do we need to do better at the point of disposition, and they're always there, and the longer this project goes on, the more a part of our network they really are. And so that has been huge for us as the system folks to really know that having people in the room, we're getting closer to the family engagement goals that we want to have.
Lindsay, can I just add as well that,
Yes.
and maybe it's coming up, that we're going to also have a survey that will be completed with families to see what their what their thoughts are and what results they've seen with connecting to the family organization as well. It might come up. I apologize.
No, it's great. And I think it's a really important piece for us as the state thinks about funding this. The state wants to know that their dollars are going in a good direction, and so the survey piece is one way to get at how can you quantify that is pretty qualitative, but are parents feeling like they understand the system better, or do they know what their young person's needs are? Do they understand how to access services? And so those surveys, which are being done for families that have been connected to, so those 173 families in the last year will all be getting calls at, is it 3, 6, and 9-month intervals, Mary?
Yes.
To see how are they growing in their skill sets. So one example, just to give, really building community trust, I think has been so critical. We've said that a lot, and it's just taken a long time. One of our counties began a pilot around what we used to refer to as domestic charges, and we now call family chaos cases, so where a young person may have assaulted either a parent or even a sibling. In those cases, as somebody who used to work in the court, never, really were so poorly managed in a courthouse context, where kids would come into detention for a relatively short period of time. There would be very little intervention. Eventually, the family would be sort of annoyed and say, "Forget it, I'll take he or she home." But nothing had really changed in the dynamic that may have caused the initial boiling point. In one of our counties, they've looked at really trying to redo that and rethink that, and PAL and the family support specialists have been critical in that. And how do we get supports to families right away, hopefully so that the charges are never filed and the young person doesn't have a criminal record. But the amount of time it's taken just to get in the door, I remember Mary called me the day that the courthouse actually gave her staff person a court ID so she could get into the building and be part of the team. And that was such an obvious sign of the trust that had been built. But it took time, and I think Mary would say she baked a lot of cookies to get in the door and develop the relationship so that we have so that we could keep building on that. And we found, and I think have pivoted at different points in time when there's been the right leadership in different places to say, oh, this is a place where we can move because that judge is going to be really supportive. So let's try to get there now, and being really strategic about how to move that forward. We constantly are thinking about other ways to fund this. I'm a big proponent in my system of funding, but there frankly needs to be a lot more. If we waited until the children hit the juvenile justice system, that's far too late. So how else do we get support for families, either through other state funding or from funding from the philanthropic world, and I think that's stuff we are continuing to look at, or on the municipal level. Some of our cities and towns, they have their own municipal budgets and ways to be supportive, so we're constantly trying to look for other opportunities. And let's see. Mary mentioned that this piece about training together has been really critical for us in constantly building on this. I mentioned an example earlier. We're there together talking about adolescent brain development, talking about the racial and ethnic disparities that are in our system, and very, very present and pretty alarming as people think of Massachusetts as progressive. We have a lot of work to do on that. Why it is that we want to figure out how do we model our partnerships, how do we make sure that in a room, if we're having a meeting and some individuals who are our more traditional courthouse partners are not eager to hear the voice of the family member, how is it that the folks who work with me, who are facilitating those meetings, make sure that the time and space is given to the family member, and be willing to challenge some of that, and eventually think about moving the times and spaces of our meetings. That's always a big one, and a little touchy with some of our partners in the court. But those are the conversations that we're having so that we can continue to engage more families in a meaningful way. I would say the support, particularly from my commissioner, has been big, the commissioner of the Department of Youth Services, but that was built on years of PAL's relationships with the Department of Mental Health and through the mental health world in particular, and now we're trying to help figure out how do they build as much leadership support in the child welfare system. But I think we see it really continuing to grow. Our next work really is trying to get to the issue of equity for all young people. We have certainly had some major problems in our system where even though the number of young people in detention has gone down really quite dramatically, that has predominantly been for white youth and not for youth of color, both Black and Hispanic. We have hosted, we created a documentary training film on this topic. You can find it online. It is called Seeing Red, R-E-D, Racial and Ethnic Disparities. And it's up on our website. But the film is really just a place to get us to the same, we really be using the same terms and understand the problem the same way. The solutions require a lot of discussion. We've trained up facilitators, and PAL has been a major support in that. So having families who will co-facilitate, often with system partners, so a probation officer or a DYS staff person, and a parent from PAL co-facilitating an interagency conversation about what are we going to do in this one community about the disparity and inequities that we've seen, and we are finding that to be a really good model for us to move forward. Right now we are in the implementation, and I think we have yet to see if we're having the impact that we need to, but it's just so clear that we need to have more authentic conversations about the inequity in our system, and nobody could bring that in more startling realization, I think, than families who have been in the system and can talk about their treatment. So that's a huge next step in our work together.
And I would say that is a big piece where families can really talk about kind of what they've also seen. So whether they're a family of there's some type of diversity or background that they have, really speaking to the roles and the systems that are in the room to talk about what they've also seen in the community. And that has been a very big, as Lindsay had said, learning curve, but there has been a very planful plan to have this conversation across the state in every area, but also within multiple both providers and stakeholders to start having real conversations about race, which has been great.
So, there is our contact information, and I think our time is up, Jane, but it's been a real pleasure sharing with all of you, and just seeing some of what you're all posting in the public chat about what's happening in your states is great to learn more about.
That was fabulous, Lindsay and Mary. Thank you so much. We've had a couple of questions about JDAI. And Lindsay, I wonder if you could describe that, whether it's federal, state, KC, Is it
Sure.
everywhere? What could you just give a little more background on JDAI?
Yep, JDAI is about a 25-year-plus old reform initiative that was sponsored and is the brainchild of the Annie E. Casey Foundation, who is still the primary support for seed money and technical assistance dollars to look at juvenile justice reform, really focus on the detention decision point, largely because we know the harms of detention are so great, meaning that young people who enter detention when compared to their similarly situated peers will have significantly worse outcomes in education and mental health and in criminal justice. There are over 300 jurisdictions involved in JDAI, lots of them on the county level, and about a dozen states, and Massachusetts is one of them, that is a statewide implementation site. So we are looking at ultimately having JDAI in all of our counties, which really just means that we have, at the heart of JDAI, we have collaboratively, we bring people together from all the different stakeholder groups, including families, and we look at our data, so we are data-driven and with an eye on equity, figure out how to collaboratively fix the various problems that exist. So even though our detention numbers have dropped by almost 60%, we still have huge problems that need to be fixed. If you think about our access to young people that might need inpatient psychiatric care, it's a real problem in our state right now on that. So we all have issues to be fixed, and JDAI is really just a structure to do it. Casey usually gives, and a lot of questions about money, Casey gives some money to sites really to kick off and to start and support some of this. Not very often are they giving a lot of money for staff people, and in this case, while I coordinate JDAI in the collaborative work, the funding for PAL is coming through our state budget and the DYS state budget.
Okay. So if somebody wanted to learn if there was JDAI initiative in their own state or jurisdiction, they might go to Casey Foundation, or just put in JDAI and maybe pull up a list?
Yep, there's a list. I just posted a link. I'm listed as guest because I couldn't figure out how to log into this webinar, everyone. I apologize. And then I'll also post a link. You'd have to make an account, but there's a JDAI Connect, which is anyone can join. You just have to join, and that allows everybody to, you can connect, almost imagine like a platform like a Facebook, but for those that are involved in juvenile justice reform.
Okay, great. And Mary, I see you've posted links to the, was it Seeing Red?
Right, that is the video that we brought across the state. It's about a 35-minute video just talking about race, and we lead that in a training, in a conversation regarding both the racial disparities and what people's kind of biases are and prejudice, and have a conversation. So that is there.
And people would be able to use that in their own communities?
Yeah, it's up online, and so we've posted it for anyone to use. I mean, we've trained up facilitators locally, and if anyone wants to talk with me about that process and what that looks like, please feel free to use my email. This is Lindsay or Mary. Reach out to either of us. But the film we made public very intentionally. The goal was to get system leaders to admit that this was a problem and that they were committed to fixing it. It is not a video that I would say is targeted towards families. I think families would tell me, I've known this was a problem for a long time. Why are you all just catching up on this? And so it's really about having the Chief Justice of our Juvenile Court, the Commissioner of some of our agencies up there saying, we know we have work to do and we're committed to doing that, to kind of give stakeholders the permission to engage. But anyone can use it. Enjoy.
Great. And Mary, another quick question. You mentioned 5 family support. Can you, I'm sure those families have lived experience. Is it a requirement that they have lived experience related to their child involved in juvenile justice?
Sure. So as, again, the relationship that we have with the department, the only real agreement that we have is that it cannot be a parent that actively has a young person that has been committed to the state right now because we don't want to put them in their own journey and have to advocate for some system change. Everyone does have lived experience, and it's levels of, it can be children that have just had a police involvement all the way up to possibly a felony charge, did need the department's support, and then had aged out. So we're looking for the experience of any type of or connection to the juvenile justice system. So that lived experience is a piece, but they don't have to have been actually in GYS to get that state support, but it needs to be, it could be they were diverted, but they do know what it's like to go to court. They know the police departments. They know the difference between behavioral health and that system and possibly the juvenile justice systems. The other thing that we ask is for the flexibility. So we do right away talk that even though this is a very part-time position, it may need really out-of-the-box thinking and ideas. And I would say that PAL is fortunate as well with in our relationship with the department that the people that we have found, they are very diverse in culture. We have a woman that is from Mexico. We have a woman that is identifies as black. We have another parent that identifies as a single parent, and one that has a biracial child, and someone else that has adopted children. So we're trying to really also do diverse parents so that even though you may be in Western Massachusetts, and your kid was more connected to city living like in Boston, we don't have to connect them to that person that directly is from their region if there's someone else that has experience. And I think that that's been a very key piece of who we've hired.
Okay. Thank you so much. I'm sure we could go on, but we want to be sure we have plenty of time for our next group of presenters. Let's move across the country to Arizona, and we have Vanehee Noriega, the Workforce Development Manager and at the Family Involvement Center, which is the statewide family organization in Arizona, and Sarah, excuse me if I don't pronounce your name correctly, Morello, Deputy Chief Community Supervision at Maricopa County Juvenile Probation Department. Take it away.
Thank you. My name is Sarah Murillo, and I am the Deputy Chief for the Community Supervision Bureau of Maricopa County Juvenile Probation. I'm also a licensed attorney in the state of Arizona. A little bit about my background is I have worked my way up within the department and have held pretty much every role from a juvenile detention officer supervisor, a probation officer supervisor, a director, and now my role as a deputy chief. I am part of the Fellows Network after successfully completing the Center for Juvenile Justice Reform MultiSystem Integration Certificate Program at Georgetown University. And I've been a leader in reforming Maricopa County practices through the implementation of a number of initiatives that support evidence-based practices, including the Crossover Youth Practice Model and Juvenile Detention Alternatives Initiative, JDAI. Based on these experiences, I understand the essential impact having family voice and engagement is to youth success in the juvenile justice system. A little bit about Maricopa County for those of you that may be unfamiliar. We are the 4th largest county in the United States, but we are the most populous. We have over 4 million people, and we cover the geographic distance of 9,224 square miles. So our large population and the area which we cover is larger than over 25 states. So it brings with it many challenges in including coordination and bringing services to families that are within a reasonable distance from where they live. So today I will be explaining the collaborative partnership that Maricopa County Juvenile Probation Department has developed with the Family Involvement Center's Parent Engagement Program, with our primary goal of preventing and reducing the number of youth that are involved in juvenile justice and ensuring that they have access to supports and services for behavioral health. So our initial vision was to engage every system that is involved in a family's life, so that not only are the systems collaborating on behalf of the youth and family, but also so that we could expand our collective knowledge so that we can intervene immediately when a youth hits the doors of juvenile justice, so that we could prevent the youth from entering formal court involvement and help reduce the youth being brought and held in our juvenile detention facilities. Our hope was to provide continuity of care and coordination to the primary caregiver in the family from the time that the youth becomes involved or is at risk of involvement in both the juvenile justice system, but also in the spirit of the crossover youth practice model, risk of involvement in the child welfare system. And we wanted to continue to support that family and that youth throughout their time on probation and while they transition back into the community, making sure that they had behavioral health and other community services so that they do not re-enter our juvenile justice system.
Hi, my name is Vanehee Noriega, and I am with the Family Involvement Center. I've been with Family Involvement Center for about 12 years, managing a variety of programs, including working in the field as a peer parent support partner. Currently, I'm the Director of Family Engagement and Enrollment, and have been intimately involved with the Juvenile Justice Project. 3 years ago, FIC was awarded the OJJDP grant after Maricopa County Probation Department recognized their need to increase parent involvement. We began efforts to connect parents and caregivers, and also through some work that we did within the detention centers, helping the probation officers and court staff understand and learn about the Family Involvement Center and what type of supports we offer families. We started by showing our presence during family and youth visitations, Tuesdays and Saturdays. We created a schedule that not only involved a variety of frontline staff, but also program managers and directors. Jane Kalal, our FIC founder and executive director, was also seen managing the FIC table during visitations, connecting to the parents. During this time, many families, and for the first time, were hearing about other parents just like them with similar journeys. At the same time, the JPOs and court staff were learning about us and also connecting families to us. This was an exciting time for us as we were opening a new door.
When we began the partnership, we did create a memorandum of agreement between Maricopa County Juvenile Probation Department and the Family Involvement Center. Some of the goals within that memorandum of agreement were that we wanted to make sure that we were providing parents with education and partner services so that we could increase the protective factors across the family and reduce their involvement with juvenile justice. We wanted to increase both parent and youth participation on our work groups to help improve our policies, practices, and procedures by taking into consideration the parent's point of view and the youth's point of view and their voice. We wanted to engage our youth with behavioral health needs in a strengths-based, individualized care planning process so that we could provide an array of services and hopefully reduce their juvenile justice involvement. We have engaged in cross-training between our departments, both educating the Family Involvement Center on the juvenile justice system and the crossover youth practice model, but also engaging the juvenile justice probation officers, detention officers in the services that could be provided by the Family Involvement Center. We also wanted to connect our parents to peer parent partners so that they could not only educate parents about the resources that were available in the behavioral health system, but also to help them navigate both the juvenile justice and child welfare systems.
How it works, parent support and involvement. I want to share a story with you of a recent situation with a family to make a point that peer-parent support doesn't only happen between the hours of 9 to 5. It sometimes happens in the middle of the night. So recently we knew there was a peer-parent support partner supporting a family whose child went into a mental health crisis. And the peer-parent support partner was also dealing with the crisis at home with their own child. At that point, I had to not only provide the support to the support partner, but also step in and take over and provide support to the parent. So with that said, at 3:15 in the morning, the parent, who was very bright-eyed because she had been in the hospital with her child all night, called me. I was asleep, which is okay because that was the agreement. And all she needed to do was to give me an update and just to know that someone was there for her. So parent-partner services and peer support does not only happen from 9 to 5. Sometimes it has to go into our sleeping time, but that is okay. In order for us to provide that support to the family, sometimes it needs to go outside of the traditional working hours. Through the initial work of connecting to parents while they were visiting their detained child, we were able to provide peer-parent support immediately, what we were calling parent support now. Sometimes on a Saturday, a parent or grandparent would share with us that there was a court hearing later that day and requested our support. After we were done with the visitations and we closed the shop, we would head into the court building with the parent and provide them the needed support, encouragement, and confidence to speak in court. Many parents expressed to us that they didn't feel confident speaking in court, and having someone there providing that emotional support made a big difference. They had a lot to say, yet they felt they didn't have a voice. Going back to our second year, during one of the visitations, we met a parent. Prior to this, she kept avoiding us, but this particular day she stopped at our table and began sharing with us what was going on with her and her child. The parent shared that how she felt no one on her child and family team was listening to her, and how at court she didn't feel confident in sharing what her thoughts were. Her daughter had been in detention for 200 plus days, and all the parent wanted was for her daughter to be home. However, her daughter was having significant mental health challenges while in detention, so she had to be sent to a psychiatric hospital to be stabilized. Once the parent heard that we could provide her peer-parent support, she was on board. Our peer-parent support partner began helping mom connect to her child and family team, help her build confidence in allowing her voice to be heard, and together with the child and family team and the juvenile probation officer began creating a transition plan that was based on the needs of this family with input from the mother. Upon youth's return home, youth supports were in place 24 hours a day, which allowed the youth to stay with her family. Eventually, those hours decreased and there was no longer a need for in-home support. This youth remains at home with her family. This collaboration involved juvenile probation officers, court staff, judges, and the Regional Behavioral Health Authority, Mercy Maricopa Integrated Care.
What we know about youth involved in juvenile justice is that they are usually involved in many systems, including child welfare, mental health treatment, vocational rehabilitation, substance abuse treatment, housing authorities, and various educational systems. What we decided to do is make sure that we were working together and in coordination with each other across all of our systems. Prior to our implementation of our multi-system approach, our agencies really worked in silos with their own visions, their own missions, really not a lot of communication between the systems. We had no formal process or expectation to identify youth that were involved in multiple systems. We lacked a consensus on what could be shared from a day-to-day case management and planning perspective. We had separate case plans and assessments, and we didn't coordinate or collaborate on our court reports. We oftentimes had separate court reports with differing recommendations, which led to conflicting judicial orders on placement and treatment needs for our youth. This resulted in increased recidivism and an increase in our out-of-home placement. Since our collaboration, we have created a formal process to identify our youth that are involved in child welfare, the behavioral health system, and juvenile justice. We now have an information sharing agreement between all of our agencies. We have a joint case plan that we use for our youth, and we are coordinating and collaborating on our court reports so that our recommendations are in sync and we are recommending the same type of treatment and placement for our youth. And we have definitely seen a decrease in the number of kids returning to our system and a decrease in the number of kids both being detained and out-of-home placement. Our program description is basically we utilize the system of care and care coordination best practices as our framework, and we design a program that focuses on the child and family and keeps them in the driver's seat of their own care. We ask our families to define what their needs are so that we could offer services and recommendations based on assessments that we do that are evidence-based. We help connect our youth and families to coordinated care, both while they are in the community, but also in detention and re-entering into the community. And we help our youth and families to navigate the juvenile justice system in Maricopa County.
How parents have access to fixed supports and services. It's through a variety of sources, primarily through the diversion staff, probation, and detention center. Sometimes parents walk in to the detention centers before their child is involved. They're seeking support to prevent their child from entering that system, and at that point they are connected to us at the Family Involvement Center. We are co-located at the Durango facility 2 days a week. So as the court staff and the JPOs are aware that we're there and understand fully what we do, they're connecting more and more families to us. Sometimes families will, if we're not on site, they will be sent to our agency on 7th Street. So they'll walk into our agency and seek support that way as well. So they're coming to us from a variety of sources, primarily through the detention centers and the staff there, and also through phone calls. They can email, the juvenile probation officers will email us the family's information where we can follow up. And we will also follow up with the family within 24 to 48 hours because the timing of that is so important for a family who is seeking support. Some of the supports and services that we offer, I'm sorry, hold on just a second. Okay. I got mixed up on my slides. The support that we offer at the Family Involvement Center, the one-on-one, which is a peer parent support partner that can work with the family in the home, in the community, in the courts, if they have DCS involvement, in the schools, that's the work that a peer parent support partner does, meets the family where they're at. For those of us that are bilingual, we do provide interpretation and translation if we have a family that is connected to us that speaks another language other than Spanish. We do have an interpreter line that we use, so that does not prevent us from connecting and offering support to a family. We do help families that are not enrolled on Medicaid. For Arizona, it's called Access benefits. We can do that on site at the detention center, or we can do it out of our office. We offer a lot of parent education. There's a lot of times you have families, parents that have not or don't know how to change things in their home. So we do a lot of skill building for them. a lot of learning about boundaries, learning about drugs and what the signs of what those are. Sometimes when you're able to give that information to the family, you just are able to empower them. Some families are afraid, depending on their legal status, they're afraid to call the police. They're afraid of their children. And so we can support them through that process and encourage them to follow what is needed in order for them to get the support they need for their child. We do have a parent helpline. This is our Parent Assistance Center, and that is staffed by parents and caregivers. And they can offer some tips. They can offer resources. They can, sometimes parents are calling because they just need to vent. Can definitely do that. Part of the array of supports that we offer at the Family Involvement Center, we have youth mentoring, we have a respite program, we have an after-school program. So sometimes there's siblings of the child who maybe has been getting in trouble in detention, but there's other siblings and the parent may be feeling overwhelmed just dealing with everything. We can offer some of that support as well. Behavioral health, supporting in navigation of the behavioral health system, the juvenile justice system, the educational system, the typical things that a parent or the systems that the parent would be touching, we can provide that support in navigating. We do offer transportation, so those are some of the supports and services that we offer through the Family Involvement Center. A lot of those families, like I said before, are connected through their JPOs, and then they will, like I said, they'll either email us, they'll walk them over to us, they'll have the family call us. Sometimes they're calling us when they're meeting with the family right there and then, and we're able to talk and connect. Sometimes we're able to walk over when they're meeting with them and just help the families see a friendly face and see someone that understands what they're going through. Okay, just want to talk about the numbers of parents served. In year one, we had a total connection of 108 families and a total of 34 enrolled. I'll talk a little bit more about what that means, the enrolled. Year two, 111 and 52 enrolled. Year three, which is the year we're in, we've had so far 150 connected and about 75 enrolled. Enrolled meaning families enrolled with the Family Involvement Center, and they're under Medicaid, under access. We're able to use Medicaid money to provide the array of support to the families that I mentioned before, respite counseling, which I didn't mention before, all the groups, the one-on-one support, and any additional supports that the family is needing. I did talk a little bit about how this connection happens. The parent is introduced to the Family Involvement Center. The family will accept the support or will accept that we will make them, give them a call. They'll say, yes, I can get a call from the Family Involvement Center, and that's where we step in and we make the call and begin the engagement process with the family. Once the family understands what peer parent support services are, because what happens is a lot of times families are telling us, please do whatever you can, I need help for my child, not realizing that this support will help you as well as, as a parent, because we can help you put those supports in place for your child, but you as a parent, sometimes you're feeling like you're there going through this all alone. And so sometimes it takes a few times for families to kind of see, and it takes a lot of self-disclosure and just kind of a lot of listening for them to see that this support is going to benefit your child, but this support is for you from a parent to parent. We have what's called, once the parent accepts that they want to enroll with Family Involvement Center, we have, we call it no wrong door, so families can connect to the Family Involvement Center, and there is no wrong door to enter into our services. We will begin to learn about the family and what's important, and we can assign a peer parent partner based on what those needs are.
I wanted to share a little bit about the collaboration infrastructure. So I know that many jurisdictions have embarked on a number of juvenile justice reform initiatives, and Maricopa County was no different. We realized that we were working on a number of initiatives, and within those initiatives, we had a sizable number of work groups. So with our JDAI work and with our crossover youth practice model work, the structure is to have a steering committee, you have an implementation team, and then you have anywhere from 4 to 6 committees underneath that. And what we saw was work group fatigue. We were seeing duplication of projects, and we really wanted to try to enhance the collaboration and communication between all of our partners. So within those work groups, we knew that we couldn't accomplish the work without the collective input from all departments. So we had members from a number of departments that we were working with on all of these work groups. Oftentimes I would run across the same person going from one committee work group to the next one to the next one. And so we wanted to redesign our infrastructure to make it more reasonable for people to be involved. And so the work that we're involved in, we have leadership from the probation department, from our behavioral health system, Mercy Maricopa Integrated Care, from the Department of Child Safety, from the County Attorney's Office, from the Office of the Public Advocate, from the Juvenile Court Administration. We have judicial officers, we have law enforcement, and we have families and youth. And so what we did is we created a Juvenile Justice Steering Council, and this steering council is comprised of all those juvenile justice stakeholders. We have a leader and a decision maker from each one of those organizations that help provide leadership and direction as our agency moves forward in our system improvement initiatives. We also have a coordination and collaboration team that really works with all of those juvenile justice stakeholders to find out what different initiatives each agency is working on, coordinating that and collaborating so that we're sharing that information and we're not duplicating work. We have one data committee that pulls data for all of our initiatives. We also have a communication and outreach committee. What we found is that we were lacking the ability to communicate effectively all of the different projects that we were working on with all of the different stakeholders, and so we created that committee. And then the rest of the smaller work groups are functional work groups that really work on ideas from every single aspect of the initiatives that we're working on. And so we used to have 2 racial and ethnic disparity work groups, one for JDAI and one for the crossover youth practice model. We combined both of those groups into a fairness committee. And the fairness committee is not only looking at racial and ethnic disparities, but looking at all of the different processes that we put in place to see if there are any disparities for other types of populations or unfairness in our processes. We have targeted services that's really designed to look for what gaps in services may we have. Do we need to add any type of services? How do we make sure that everybody is aware of all of the different services that are provided by all of the different agencies that we're working with? And when a specific population comes into play, like currently we have our sex trafficking victims that we're working on, what services do we need to target that specific population? We have a process improvement that's really looking at our processes to see where we can make improvements to become more efficient and more effective. And then we also have our prevention committee, which is really focused on providing prevention efforts to make sure that we can keep kids from either entering the child welfare system or the juvenile justice system. And so this has helped to really coordinate and collaborate between all of our partners.
The parent that I spoke about in slide 6 last year joined FIC Sarah Murillo, Mercy Maricopa Integrated Care, during a presentation at the Federation of Families, where she shared her journey and inspired hope. She, along with other parents, she, with other parents, also served through this grant, also participate in other committees and forums. Parents want to give back, and some want to work at FIC. They want to use their story to help others and want to make changes to the system. They have been part of helping us develop new approaches and will provide feedback on what works and what doesn't. I anticipate this area growing in numbers as parents learn more about the importance of their voice in child-serving systems. We're also starting to brainstorm ideas along with parent leaders in the development of a roadmap. It would be kind of like what to expect when your child is entering the juvenile justice system. This would be developed for parents by parents. The way we measure data collection and outcomes, we use what we're calling a parent planning tool, which is integrated into the tool is the 5 protective factors: parent resiliency, social connections, knowledge of parenting and child development, concrete supports in times of need, social and emotional competence of children. This helps us help the parent identify and prioritize their needs. Also, while we're meeting with the parent, we're also assessing which of our peer parent support partners are the best fit and match for them. We use the parent planning tool to help us determine, and during the time of engagement, we also learn about the parent's areas of needs and strengths, and the tool helps us identify and help the parent prioritize their needs. We're able to create their plan of support, which we call the support plan goals. The parent can have 10 areas of need, but this will help us prioritize for them or help them prioritize their needs, which is the guide that the peer parent support partner will use to provide that support to the family. Launching into the future. This program has been the launch for the way we are doing business. It has led us to change and refine the way we connect, enroll, serve, and develop parent leaders. Family runs are important, and we are looking for ways to show the value of their unique services. This grant and all our partners gave us the framework for a collaborative arrangement where we could come together, big parent funders, our MCO, to determine what we need to do to improve services and support to families. The leadership at MCJDP and Mercy Maricopa Integrated Care understand our role within child-serving systems and support the Family Involvement Center. To me, this makes all the difference when we are seen as the experts when it comes to peer parent support. There's some questions that came up, right? Does the grant pay for the parent helpline? That is part of, I believe, I know Jane Kalal, our executive director, is online as well. I do believe part of that is funded by that. And then is there a parent that answers the parent helpline? The Family Involvement Center, 95% of the staff employed here are parents and caregivers. So specifically, the parent line is staffed by parents who have similar journeys of raising a child with behavioral health challenges, special needs, or involvement with juvenile justice. The parent planning tool, we do have a copy of it. We can send it online. I don't have it right now, but I can definitely get that to you guys.
Great, great. Sarah and Angelica, that was fantastic. I wanted to ask also about your workforce. Angelica, in terms of working with the juvenile justice population, do you have a requirement that those parent peer support providers have had experience in the juvenile justice system?
Yes. So we have a pool of peer support parent partners, all with different life experiences, just like our children, have taught us. And we have a specialized group that is flagged as the Juvenile Justice Peer Support Parent Partners, and they have the lived experience firsthand with their own children, and they're able to offer that support. Now, internally and in collaboration with Sarah and her team, we do training. We connect with their staff. They come to our group oversights and provide us training on what it looks like internally. As we know, sometimes there's a lot of acronyms within our different systems, and so just to kind of stay on top of that, we've done that, and then we've also gone over to their sites and provide them, as we have new programs, provide them information on the Family Involvement Center.
This is a question for both Mary and Angelica. Do you do any specific training for those staff working in juvenile justice settings? The juvenile justice system, in some ways like the special education system, has very distinct procedures, things like that. And so do you do any training to prepare your workforce to work in juvenile justice settings or with families with juvenile justice?
I think we do some, and again, it goes back to the type of topics that we bring to our group oversight or one-on-one. And just like the work we do with our families, we're constantly listening to what families are needing, same way we do with our support partners, and we're listening to what they're needing, and we work on bringing them trainings in the areas. A lot of them are very, very seasoned. Some of them have had more than one child go through that system, and so they're very confident and capable. But yeah, when we run into situations, and it kind of goes down to the level of supervision, the one-on-one supervision when you're identifying and kind of checking in with that staff. But yes, we will personalize if we start hearing about trends with the staff, and that goes across the board, whether they're targeted for the juvenile justice or the other child serving systems.
Mary, how about you?
In Massachusetts, we do two things. We specifically do kind of a juvenile justice 101 with our parents, but they also go through a peer-to-peer curriculum where we talk about the culture shift, boundaries, kind of power over, power with, to be able to talk about the different struggles that we're going to have with just making the change within a culture. And then I would say the last thing that we do is Lindsay will train our staff kind of from the language that the court or the system uses so that our parent leaders, our family support specialists can actually understand from that lens. And I think the most important thing we do besides the training is anytime there's a flow chart that the state uses with families, we actually create it and break it down into more of a tool. And I'm sure that you guys do that as well in Arizona. Breaking down the language to make it in the family-friendly language is most important.
Great.
And I will mention, I just saw a question regarding privacy specifically for us. The department has a checkoff box where they ask the parent if they can give their information to us, and it's a simple checkoff of yes, they don't need to have, it can be verbal, it doesn't need to be signed, and that has been a huge piece that we've talked about, the referral for families to actually just come voice to us rather than another brochure or another piece of information signed that they don't understand. That's how we've gotten around to the privacy issue.
Great. So
we
again,
have,
Mary, sorry, go ahead, Angelica.
Sorry, this is Angelica. So we do have the parent support now form that the juvenile probation officers have. that's a form that, the parent will sign. And like I said before, a lot of times they're calling us when the family is right in front of them, or they'll walk them over to when we're there co-located. And so that has not been a barrier. But yeah, we do have those kind of, and if a family, maybe the timing of it, because they have a lot of things going on, if they're not interested at that moment, we just, we might check in with them, a couple of weeks later and kind of see where things are at. Sometimes you just kind of have to remember that sometimes families have a lot of things going on, and I certainly don't want to be a burden, but sometimes it's just about the timing. But yeah, we haven't ran into any problems with that.
Okay. So Lindsay and Sarah, a question for both of you. From your perspectives in your agencies, do you have suggestions on how family organizations could approach their juvenile justice partners if there's been no previous relationship with them? So we have family organizations across the country online. How might they approach their JDAI program or juvenile justice or probation or what? So let's start with Sarah.
So for Maricopa Juvenile Probation, family engagement is something that we train from the moment a probation officer starts. So it's really ingrained within our culture. But I think you struggle in juvenile justice with actually implementing it the way that you should as far as really engaging, because a lot of families don't know how to share their voice, and they don't know what services are available, so they just are quiet in meetings and just let the probation officer or the experts direct them into the correct services. So I think for Maricopa County, where we ended up really employing the family voice was through the crossover youth practice model. So if agencies are involved in that model through the Center for Juvenile Justice Reform, family engagement is a component of that, and so that would be one way to get some buy-in from the juvenile justice agency that you're looking to connect with. But I think most juvenile justice agencies understand that usually it's not solely a youth issue or a youth problem of why the juvenile's entering the juvenile justice system. It's usually a whole entire family dynamic, and so if you can get that buy-in through that and really explaining the different services that you can provide, how the services that you can provide can help the goals that the juvenile justice agency may have, such as reducing recidivism, I think that you should be able to get that buy-in by explaining how you can jointly manage the same, that you basically have the same mission and vision and you have the same goals.
Okay. Lindsay, any thoughts?
I think the only thing I would add is that juvenile justice reform has been in vogue for quite a while now across most of the country, and so there is probably something going on, as was mentioned in Maricopa. There are lots of different things that were going on, so much they had to figure out how to coordinate them. And so whether it's that your county's involved in JDAI, or they have, which you can find online, or they've received various, they maybe have been people who applied to the Georgetown Center for Juvenile Justice Reform or received an OJJDP grant at some point in time. And often they may not have been inclusive at first in some locations, and so it's trying to find who are those leads and that are trying to do this work and express, as was mentioned, the value of bringing families to the table. So digging it out, and you need a person like Mary, who in our jurisdiction just found us and then didn't let go, and 10 years later has a grant and a whole bunch of staff, which is amazing. But I do think, Mary, you might be better able to speak to how hard that was at the beginning.
Yeah, I think it comes down to having the one-on-one conversations and being able to find the right partner and leader that's going to be there. And I would say the leader also, that if they're going to be close to retirement, it may not be the person to make the connection to. And I know Annie Casey talks a lot about being able to make partners that are going to be around in a system. But I think breaking it down for people to understand what family engagement is, it's a big concept that's out there, but if you talk about interaction and involvement with families and then get to engagement, and Justice for Families does a good job talking about the interaction and getting to partnership, then I think that's a really big piece that needs to happen. But the trusting relationship really for us in brainstorming and teaching, I would say that many of my conversations took 7 times having the same conversation, and that's just what it takes to really understand that these kids are our kids in the family organization.
Mm-hmm. Great. We are almost out of time. We do have one more question from Maggie about do you have interaction with your state advisory group for juvenile justice? And I'm not sure that, I think that's geared to the family organizations. Do you have seats on state advisory groups? Are there parents on those advisory groups? And we'll just need a short answer from Angelica and Mary.
So in Massachusetts, we're on the statewide strategic plan, and we are also on policies for our criminal justice reform, both parents as well as the family organization.
Great. Here, how about?
And we are, yeah, and we are too, and the plan is to continue some of the families that we have served through the juvenile justice project to also prepare them to be part of some of these. There are families already involved, but we have some more recent families that have identified wanting to be part of that. So we're in the process of preparing them to be part of those juvenile justice groups.
Great.
And we're fortunate in Massachusetts to have 2 young adult peers on those. And I would say one other piece that typically isn't looked at as kind of the policy level, we are in conversations and have some seats with some of our cities as well as the law enforcement group, which I think that's a piece we didn't look at closely enough if we could do it again.
Right. We haven't looked at law enforcement or courts, both very, very big areas as well. But we really need to close this out. You guys have been super fantastic. What you're doing is just awesome. We have some resources here and a link to Justice for Families that Mary mentioned. So these will be on the PowerPoint that you can download. As the Institute indicated, it's available for you to download. I also wanted to remind you of our March 22nd Next Learning Community on the front lines, families and family-run organizations responding to the opioid epidemic, a major, major topic. But one other point I just wanted to mention, I hope everyone knows that last week SAMHSA announced a funding opportunity called an FOA for 5 statewide family network grants, $95,000 each for 3 years. Fredla sent out a Great Ideas newsletter yesterday with lots of details about that. We are holding one component of the application is a whole section on participant protections and confidentiality. Our learning community last month focused on that topic, and because there's lots of questions about that now that the FOA is out on the streets, Fredla is hosting as a follow-up to last month's learning community something that we're calling office hours, and that is when a family-run organization can just call in and ask questions. Peggy Nickel from Fredla will be available. Peggy did the webinar last month. It is February 27th at 3 p.m. Eastern Time. Your questions are only related to that section on participant protections and confidentiality. We cannot answer questions on any other parts of the grant. We'll be sending out notices about that again, but please, if you're interested, March 27th at 3 p.m. Eastern Time. So this is information about SAMHSA. We want to thank them, and very importantly, we want to thank our tech support, Gary from the University of Maryland, for hosting the webinar. We couldn't do it without you, Gary. And as always, thanks to everyone, our presenters for their fabulous job, and to all of you for spending part of your day with us. Enjoy the rest of the day, and please know that Fredla is available to you if you need any technical assistance or resources. So thank you so much,